Thibitari wa Londiani kaunti-ini ya Kericho ni umwe wa mathibitari maria mahotete kwarira mitaratara na mifango ya kugiririria ugwatania wa murimu wa mukingo kuma kuri muciari nginya kuri mwana. Kuringana na ndari cia ica ikuhi andu milioni 1.4 nio mari na murimu wa mukingo guku bururi-ini, guku andu milioni 1.3 ario mari rungu rwa mubango wa kuhuthira dawa cia ARVs niguo kunyihia moruru ma murimu uyu. Hari na beno ciana 48,000 nicio iri na murimu uyu, guku namba ya atumia aria marongithia na mari na murimu uyu ikirungamira 56,000. Icera-ini rito wadi-ini ya maternity thibitari-ini uyu turacemania na KURI uria wirigireire kuheo mwana wake ri ihinda-ini o riothe kuma na riu, na haha gatutariria thafari yake ya kuoha nda.
Nilikuwa najifungua hapa mara ya kwa first born na walinisaidia sana, ndio maana nimekuja hapa tena kwa mara ya pili. Nilipenda hapa juu wanasaidia sana, na unajua kujifungua nyumbani si vizuri.
Kuringana na nathi uria rugamirire mihango thibitari-ini uyu uria wina uhoti wa gukorwo na mariri manana ma gukomwo ni atumia aritu, ni ugite wadi ino ni kuo mateithagiriria atumia aria magumirwo ni murimu uyu uria mangika niguo gwithema na gutheremia murimu uyu kuri mwana.
This facility has helped us because in case the mothers who are HIV positive are delivered at home, then the care will not be efficient as we have here, so we manage them efficiently when they are here because we are able to know their status and also be able to do the interventions that are required.
Kuringana na uthuthuria uria tafanitio ni ruhonge rwa ugima wa mwiri rwa Kenya Health Information System gatagati-ini ka mwaka wa 2021 na 2022, kaunti 18 ni cigumirwo na namba nene ya ugwatania wa murimu uyu kuma kuri muciari nginyanagia kuri mwana. Kaunti ici ari hamwe na Mombasa, Lamu, Taita Taveta, Kitui, Machakos, Kericho, Nyeri, Murang'a, Trans Nzoia, Uasin Gishu, Elgeyo Marakwet, Nandi, Baringo, Vihiga, Busia, Kisii, Nyamira na Nairobi. Kuhana uguo mutafariri wa mihango ya kuhurana na murimu uyu kaunti-ini no Amos Kemei ni ugite gicunji kia ugwatania wa murimu uyu kuma kuri muciari wa mutumia nginyanagia kuri mwana urugamire gicunji kia 8.6 hari igana guothe bururi-ini na gicunji gia 10 hari igana kaunti-ini ya Kericho.
Prevention of mother to child transmission, that is PMTCT. Again, we are doing well because currently we are testing over 60,000 mothers per year, and many of them have been put on treatment, so therefore they will be able to get children who are HIV negative.
Hado-ini ha Kameme TV, jitagwo Gathoni Wang'ang'a.